Hello, everyone. Welcome to Octavia's Cure, a conversation series about reimagining healthcare and public health for all of us. I'm Dr. Stella Safo. I'm an HIV primary care physician, a public health practitioner, and the founder of Just Equity for Health. This series is inspired by the visionary spirit of author and futurist Octavia Butler, who believed that the future isn't something that just happens to us. It's something that we build together, that we have an impact on, and that needs to be grounded in community and in truth. Today's conversation is one that I've been looking forward to for a long time. We are living in a moment where our public health infrastructure is under real pressure and attack, and where trust in medicine is fragile or broken, especially for communities that have always been underserved. Many of us are now asking, how do we not just survive this moment, but actually build something better? To answer this question, I think we have to look back at communities that have already done this work. And HIV is one of them. So HIV advocacy didn't just fight for the improvement of a disease, it fought for dignity, for science, and the right to be seen. And it won many, many battles. It also lost some battles, but most importantly, the movement has kept going. My guest today has lived that fight from the inside as a clinician taking care of HIV patients in communities hardest hit by this epidemic, and as an advocate moving policy and procedures forward that will treat and eventually end the HIV epidemic. Welcome Dr. Oni Blackstock. She is a primary care physician and an HIV doctor, as well as the former assistant commissioner for the New York Department of Health. She's the founder of Health Justice, and she's one of the most powerful voices in this country on what it truly means to center equity in healthcare. So please welcome Dr. Blackstock on Octavia's Cure. Oni, I'm so glad that you are here. I want to start off by having you talk a little bit about your career and kind of what got you to this point, because you have this really interesting background of academia, public health, and advocacy that comes together.
Stella, thank you so much for having me on. It's an honor to be here in conversation with you. Okay, I was so caught up in your wonderful introduction. You had asked me a question.
So the question for you is, tell us about how you got to this point in your
Yes.
career, your background in academia, your background in public health, your background in policy and advocacy
Yes.
work, and as someone who really, is at the front lines of how we implement equity into healthcare delivery.
Yes. So, I mean, as you know, but maybe as some of the audience members might not know, I started out in academic research. I always had a deep interest in HIV. For me, it wasn't just like a medical condition, but it was a social structural condition. You know, when we see who's most impacted by HIV, and so I was always like, oh, it's so great how these medications are so effective at suppressing the virus. And also, that's like not the only thing that we need, because clearly there's certain communities that are being impacted more than others. So fell in love with sort of HIV and learning more about it from medical school, where it was in Ghana, West Africa, and in South Africa. And I remember coming back after doing 2 rotations, like one in Ghana and one in South Africa, and coming to Harlem Hospital, and seeing like some of the same sort of advanced sort of manifestations of HIV. People were dying of opportunistic infections right here in my neighborhood. And so that was really a call for me to really dedicate my career to this work. So, as you know, did the research, the NIH CDC funded research. And I think, I always had questions when I was seeing my patients, and so wanted to know how to ask these questions in a rigorous and systematic way. And at the same time, the realities of research were challenging, right? Like, so I remember writing about HIV in women for a grant proposal and having the reviewers say, is this really an issue? Like, we don't think this is an issue for Black and Latino women. So I was up against that tension and having to like prove that these were issues that were important. And so as sometimes you get that little email or that call. I got a Facebook DM from a close colleague who was like, Oni, they are looking for someone to lead the Bureau of HIV for the New York City Health Department. And we need someone like you there. So, so I almost felt like it was like writing that cover letter was like the easiest thing I did. And the funny thing is, and then I'll just finish up. When I was a research fellow, I actually shadowed the person who was the assistant commissioner for the Bureau of HIV, who was in that role. And I remember thinking, oh, she has the coolest job because she's like in the office, but she's also in community and she's all over the place. And I was like, that's a cool job. And then I kind of forgot about it until I got this DM. So then moved to the health department, was really doing work on a much larger scale. We were getting millions of dollars from the federal government to then distribute out to community-based organizations and clinics and hospitals. And so that was really amazing, I think, impactful work. And then the pandemic hit, and I was like helping with the COVID response for our health department, trying to keep our bureau safe and still doing the work that we could. And it became clear to me I needed to transition, and so started Health Justice, which is my consulting and research organization. So I've been doing that for the last 6 years.
I will just say that when you talk about your career, I always think like that is the coolest, and I wish I could do that. And what is funny about it is that I've always followed in your footsteps. And so Oni went to Harvard a few years ahead of me. I was at Harvard Med. You went to the social medicine program. That's where I trained. Then you did the HIV fellowship. I followed you in doing that. So I always laugh whenever people are like, "Oh my God, your career is so unique," and I'm like, "No, you need to go talk to Oni because I've basically done everything that she's done." So thank you for paving the way.
Oh, but you're welcome, Stella. But you also put your own spin. I never think of it as like the same. I mean, I think of it, as our paths are like parallel, and also like how we've put our own spin on stuff. So I'm just honored to be sort of
Yes.
walking this path and doing this work with a colleague and a friend like you.
Yeah, well, I want to ask you about some of the things that I think really come up from the HIV world. You mentioned working in Ghana, working in Harlem, and I think a big part of what it takes to do this work and bring people in and community in is trust.
Yeah.
And I've been thinking a lot about trust because trust is very broken right now. People don't trust institutions and they don't trust individuals. And I'm curious about, from your perspective as both a researcher, someone in public health, a clinician, what lessons can we take from the kind of role of trust and how HIV advocacy has happened, and how do we bring that into this time
Yeah.
when we're faced with this crisis of trust to really be able to get communities, and I don't want to say it in that way like transactional, but to be able to reach communities that I think could be helped by some of the interventions and other things that are out there.
Yeah, no, I think like HIV is such a a perfect case example for how to do some things right, and then how we've learned from things that we haven't done the best. So, for instance, I'm thinking about U equals U or undetectable equals untransmittable, how that data, that information about how HIV medication, if someone who's living with HIV is taking their medication and they are suppressed, that they have effectively no risk of passing HIV onto their sexual partner, that took a while for community members to sort of more broadly learn about because, the healthcare and the scientific institutions were keeping that information. We were keeping that to ourselves because I think there was a worry. Well, what if we weren't exactly right? What if there is like this infinitesimal chance? And because of that, people living with HIV and people who love them had like one less tool at their disposal to stay safe, stay healthy. And so that's when we saw community really coming to the forefront. Bruce Richmond and Prevention Access Campaign being like, wait a minute, like starting to question, like, Doc, why haven't I heard about this? And then creating a coalition of folks across the world, across the globe, with a very simple statement with like 3 letters or 3 characters, U equals U. Um, but having that coalition of everyday people, of advocates, that is what I think helped to rebuild that trust and sort of bring back in the science of it, and then having, the health department here in New York City and New York State and the CDC then sign on and say yes. But people are like, why didn't we know this? Why are we now learning this? So a lot of times it's been community having to check, public health, check researchers, check the NIH, CDC, and say, hey, you guys, you aren't doing this right. So a lot of the trust has been because community has spoken up, but also because scientific community and public health community, they've also responded and been in that conversation. And it hasn't always been easy, like thinking about ACT UP in the early days. I'm also, and then just let me know if you want me to move on, but I'm also thinking about another global HIV related issue where I think trust was undermined, but I think it was able to be repaired. When I think about back in 2018, dolutegravir, HIV medication, there was some surveillance studies that were being done where they
Yes, I remember
saw,
this.
yeah, like a little
Hmm.
signal, very little signal. It was like less than 1% of the babies being born to pregnant people who were taking it had something called neural tube defects, or sort of irregularities, or in their nervous systems as their babies were developing. And so the decision was a number of countries just took that medication off their formularies. WHO warned against people of reproductive capacity taking it. Instead of having pregnant people, lactating people who can get pregnant, having them make the decision and say, you know what, if I know this medication, it does have a small chance, but it's also really powerful and it can keep me healthy and it can keep me safe, and let us decide. And the year later, the WHO, they changed their recommendations and said, let women decide what is best for them, or let pregnant people decide what's best for them. And then they found out 4 years later that that signal ended up going away with the more data they had. And actually, it, in fact, was a safe medication for pregnant people and their babies. So, I think, being called out and then like doing the
Hmm.
repair is like incredibly important. I think that has helped to build trust in terms of community and public health and pharma in the space of HIV. Although it's not perfect, you know what I mean. But and also just to say one other
Far
quick
from
thing.
perfect.
Yeah, no, totally. And one other quick
Yeah.
quick thing, we know, like from the early PrEP studies of the medication to prevent HIV in people who are HIV negative. Those in women, cisgender women. I don't know if you remember, like the FemPrep and Voice studies. Those were quote unquote negative
Hmm.
studies, right?
They were
It
negative
it, like,
studies.
it
Hmm.
it looked like this medication was not protecting women, but when they looked at it, the women weren't actually taking the medication, and that's because
Right.
the researchers didn't go start from square one and say, how can we partner with community in developing this study? What
To
are going to be
take it.
reasons why people might join this study and not take the medication? And it ended up that women wanted access to healthcare. And they had
Hmm.
their partners and family were like, don't take this medication. And so because of all of that, we saw the purpose study with lenacapavir, the every 6 month
Hmm.
injectable, really have much more community input, and I don't know, potentially decision making as well, and doing that the right way.
That is brilliant. I want to say, as you're describing this, I do want to acknowledge for folks who are listening, like the HIV world is a little bit special because it was a condition, it was an epidemic when it started that was really shocking. It took young people, it took white people, it took, and so the advocacy and the space that I think HIV occupies is different. And so when you think about other conditions, other chronic diseases like diabetes or hypertension that impact certain populations, a lot, there may not be that same receptivity to change and to movement and to improvements from the pharma world or from clinicians, from institutions. And I'm just curious about what you would say to those bodies. What are the lessons that those bodies can learn from the kind of their HIV counterparts about how to receive critique,
Hmm.
feedback, insights from community? Because I think that again, that's something that the HIV community is kind of trained,
Yeah,
the
yeah.
HIV suppliers and public health folks to be receptive to.
Yeah, I think, and I really appreciate that point you're making about how HIV is unique in that way. And it's because like community had to learn, they were learning in parallel with the scientific community. They were, people were caregivers of people early in the epidemic. They were learning about AZT, like everything was happening in parallel. And so that's a little different for other conditions. But I think, and I also don't want to, I know there are patient advocacy groups and activists, across other medical conditions. But I think what healthcare and research institutions and public health departments have to learn is like, some of that cultural, that humility, that structural humility. Like we are not experts. Like we may know what we're doing very well, but community members are experts in their own lived experience. And how do we create, channels in order to, cultivate that trustworthiness, that communication that is so critically important. And as you probably know, in HIV, there are lots of advisory bodies. So at the health department, we have like tons of advisory groups, and I don't, and so, and I always kind of feel some kind of way a little bit because, we don't want people just to be giving us advice. We want to be in this to be a shared leadership, type of approach. So I would just say that in other, we still need to do this in HIV, but in other conditions as well, like really see where can we do decision making where it's not just people giving input and we're like, okay, great, we're going to do whatever we want to do, where we're like really working in collaboration with our community.
Yeah. And I think that that is learned. So I think
Yeah.
that, again, that's why I'm calling folks to look at the world of HIV because there are things here that need to be brought into the kind of larger public health space, the larger healthcare delivery space. And now is the time to do it. One of the things I want to particularly call on you for is, when we talk about trust in community, one of the things that's a big part of it is communication, how we communicate
Hmm.
with individuals. And that is something that we're really struggling with now, I would say. The things, depending on where you get your information from, social media or otherwise, it can feel very partisan. And you're someone who's done a really good job of communicating complex principles in a way that people can receive and really understand. And I'm curious, in the age of mis and disinformation, what would you say to trusted messengers, to healthcare and public health leaders about how we can be successful in the communication game, if you will, and being able to talk to people so that they feel comfortable engaging in healthcare, doing certain healthcare practices like vaccinations or whatever it may be that is helpful for all of us? How do we communicate in a way that could reach people?
Yes. And just wanted to also like give a head nod to you for the amazing trusted messenger role that you play in our community. So, I think the challenge is that, with public health, for instance, so much of the work is invisible. Like a lot of the work that we do in HIV care, supportive services, it's not always like evident to everyone what's happening. And so one of the things I think we need to do is like speak to the work that we are doing, like with a steady drumbeat, like consistently, and not just during like crises or when we feel like we're losing the trust of the public. It's like we have to do a better job of telling the story of public health, of healthcare. Because otherwise someone else is going to tell that for us, and that's essentially what's happening. And I also think that some of the work I've done with racial equity has taught me about the importance of like shared values. So like identifying shared values as like an entry point to talk about whatever the issue is. So it's like we all want, to see our children like grow and be healthy and live their fullest lives. However, like we're not seeing that. And when, just going on, and we don't see that, or, we know that when children don't get these sorts of interventions early on, they are more likely to have worse outcomes. Um, that is why we recommend vaccination or whatever, but really just like trying to find where we can be aligned with folks who might have different perspectives, and us might have perspectives that actually are rooted in a lot of systems of oppression and trauma, so that can be really hard. But just really keeping up at it, and also just making sure, I have to be honest, like making sure our communities are safe and have the information they need, because a lot of that, there's the inequality driven mistrust, right? We have like right wing. We have that mistrust there. And at the other end of the spectrum is the mistrust that comes from people being systematically marginalized and excluded. And I think for us, that's where we can do a lot of our work. And then, other folks can also be bringing in other folks, under the tent and saying, look at this information. This works well. And yeah, so I think, I think we're all still trying to figure that out. But I think the shared values part is really important because that's how you open the conversation and you keep it open.
We'll return to Octavia's Cure after these messages from our sponsoring partners.
You deserve care that sees you, respects you, and keeps you safe. The Green Book for Health is a community built guide designed to help Black patients find affirming providers and to navigate the healthcare system with more confidence. Inspired by the legacy of the original Negro motorist Green Book, the Green Book for Health centers community wisdom and lived experience. Our resource guide is available now, as is our community guide app, which you can find wherever you download your apps. Please join us at greenbookforhealth.org.
And now, back to the podcast.
1,000%. And I think also part of what is challenging is that some of the structures that we're in, like public health communications, like some of the clinical interactions that we have, can feel very paternalistic. It's recommendations of like,
Yes.
you do this, and I know a lot of people took the mask recommendations and mandates that way of why are they telling me that I have to do this? And so I think as we move into this world of trying to better communicate, better connect, there is certainly a listening aspect to it to understand where folks
Yeah.
are and a bidirectionality in the
Yes.
communications, that I think sometimes is missing from the spaces that we're in. And you mentioned, and I'd love for you to speak on this as much as you feel comfortable doing so, that we're in this political moment where it feels like there's hostility to certain civil rights and accomplishments that we've had. We've seen the reversal of affirmative action. Certain words feel like they're being challenged, like diversity, equity, and inclusion, health equity. And I think people are rightfully scared and nervous. And I see folks like you and me, we're out there and we're like, we're still going to do this work. And I'm curious about your thoughts and, using the examples from HIV and just your own, lived experience. How do you and how should we as a collective sustain advocacy and protecting the rights that we fought so hard to gain when it feels like the ground is shifting under us, when it
Yeah.
feels like we are losing, mileage every day in the fight towards justice and equity? What would you say about folks who are like, why are they even talking about this now? Like, look who's in office or whatever.
Yeah.
Like, what would you say about the time that we're in and how we should be
Yeah.
thinking about it?
Yeah, well, I think often about like the lineage that like we're a part of. I think about the history of this country, and so we are at a moment, but there's like a whole bunch of history that preceded this, and there were times where things felt really bleak, where thinking about Reconstruction. Which was that 10-year period after the Civil War where there was tremendous progress for Black folk, and then almost as soon as it started, it was like quickly squashed by Black codes and Jim Crow. But even while all that was happening, Black people were fanning across the country, seeking opportunity, safety, setting up, communities, here in New York, where my great grandparents came, the Harlem Renaissance evolved out of that. Um, the NAACP, the earliest Black-led labor movements with A. Philip Randolph. So it's like I always feel like we have the model of how we have to keep pushing forward, because the thing is like Marian Kaba says, like, the difference between optimism and hope. Optimism is that, we just assume we're going to have a positive outcome. Hope is like doing the thing and the outcome is uncertain. But we do know if we don't do anything, nothing's going to happen. Nothing's going to change. So for me, it's like we got to keep we got to keep pushing forward. And if my ancestors hadn't pushed forward, or my foreparents, I might not be here today. So I think it's that legacy that I always like look to, that keeps me going. And I also think about, people are doing stuff. Like, it may feel like, we turn on the news and we're like inundated with all the chaos and harm that's happening. And then we also see there are thousands, millions of people like Miriam Cobb, the abolitionist. She always says people are in movement. People are moving constantly, and I see this, and that also brings me hope. And so, if we can be also parts of collectives that are doing work, that are doing this, we can lift our voice. If we can give to an effort, that it makes it makes it worth it, and it gives us a chance. I think each of us individually, as a collective, we can actually shift things.
I think that's brilliant, and I think it's about meeting yourself where you are. I met a trans woman who said, I'm moving to Spain in August. I'm gonna move, and I don't think I'm gonna come back. And I just appreciated her clarity around that because she said, I feel so targeted in this country. I don't feel safe here anymore. I want to be somewhere where I feel safe and I can thrive. And God bless her, right?
Yeah.
Because not all of us need to be fighting the fight in the same way. She'll be somewhere else living her best life, thriving and adding to just, the way that the spirit kind of, our collective spirit can be inspired, right?
Yeah.
And there'll be others who are here, who want to stay, who want to be in movement and in participation of making this country, its best ideal of itself. And so I want to acknowledge and honor wherever folks are falling and whatever they feel like they need to do. And I love everything you've said about our ancestors. It's part of the reason why I feel so passionately about the Green Book for Health that we're
Yes.
creating, right? The original Green Book was needed in the time of the Jim Crow South, and we're living in times that feel very targeted. And so, we bring back a resource like the
Yes.
Green Book in healthcare, and we think about how we can guide Black folks towards safe healthcare.
Yeah, I love it.
And I invite all groups to be thinking about how we can do that, across the collective. I want us to end on a note of hope, which you've already inspired and given me, and I want you to share any lessons from the HIV world and your work that you think should give people hope of what is possible. And I also just want you to just speak forward of what gives you hope and what
Yeah.
makes you feel like maybe things will be okay and we can be hopeful in the way that you've described. I love the Miriam Kaba quote, and I would just love to hear
Yeah.
about your thoughts on what gives you hope.
Yeah, I've been doing so much looking back, and learned for some reason, even though we've both been HIV for so long, I hadn't been up until like 5 or 6 years ago familiar with Katrina Haslip's story. And Katrina was a young Black Muslim woman from New York who was incarcerated, Bedford Hills, it's the upstate women's prison, and she was a law librarian there, and she also was diagnosed with HIV while she was incarcerated, and she started, along with two other incarcerated women, AIDS Counseling and Education, or ACE program, which was by and for incarcerated women,
Yes,
and
I
teaching about
just heard about her
HIV.
story recently.
Yes, yes, and that model spread to other prisons and jails across the country. And Katrina, one of the main things that she was outraged about was that, you know, the way that AIDS showed up in women's bodies, or cisgender women's bodies, was different from how it showed up in cis men's bodies. And so, in particular, invasive cervical cancer. And there were conditions that the audience may not be aware of that didn't count for an AIDS diagnosis. And because of that, women could not get an AIDS diagnosis, and they could not access the disability benefits that came with the AIDS diagnosis. So literally within like 2 weeks of being released from prison, she was like on the steps in DC of the Department of Health and Human Services with ACT UP. She was on probation, but so she wasn't supposed to be there, but she was there anyway, and she was protesting and saying, women, we need to be recognized. You all have to do something. And in December of 1992, she passed away at the age of 33 from complications from AIDS. And a month later, the Department of Health and Human Services changed the definition of AIDS to include invasive cervical cancer. And she led that fight, and she didn't see that victory. It didn't happen while she was here, but she fought anyway. And so I just look to like people like her. Like, I think of her as like, a movement mother, and just the fortitude and determination she had. So that is like what keeps me inspired. So I may not see something in my lifetime. It doesn't mean that it's not worth the fight.
Ashe. Thank you for that, Oni. And thank you for being here and sharing your wisdom, your hope, your light, your incredible advocacy. Thank you all for listening in. The history of HIV advocacy is proof that when communities come together with courage and clarity and a refusal to be ignored, things actually can change. So every disease or health crisis or broken system has lessons that I think it can take from the HIV world if we're looking to look and understand it. And that's what I'm hoping that Octavia's Cure will continue to do. So join us next time as we continue this conversation. Thank you. Octavia's Cure is a production of Just Equity for Health. This episode was hosted and executive produced by Dr. Stella Safo, with creative director and producer Amanda Masidi, post-production and graphics by Simon Cowart, and digital content production by Devin Johnson. Learn more about our work at octaviascure.com. If you love Octavia's Cure, please subscribe wherever you get your podcasts and leave a review so more listeners can find us. Thank you.